it was just easy to see leveraging on the financial sector, how everybody now is on phone banking, you know. It was easy to think that we could try this in healthcare and leverage on the same tele-density to improve access to health, but then take it further to enhance quality of healthcare.
Telehealth has always been there, actually. In fact, many doctors do practice telehealth, but I would say what we do at Doc, we actually transitioning from what used to be an informal art into a more formal way of doing it.
It is a program that is sent us to alleviate problems of the masses. Easiest to get access to a medical doctor. You can be anywhere, any place, and have access to a doctor.
We bring in your conventional health services, online for people to access, and more importantly, from the comfort of their homes or office or workspace, wherever it may be. So the whole essence is bringing the hospital, bringing healthcare to people, as against our traditional way of people accessing healthcare.
Having used the NHS direct service, and I saw how there was a lot of focus on preventive healthcare. Here in Nigeria, when you say healthcare, it's mostly curative. I saw how there was a direct focus on preventive healthcare, and it also made sense that you could introduce something like this back home. And
it is quite fortunate that Abia State are the first state in sub-Saharan Africa to queue into these projects.
So part of what we tried to do for universal acceptability was to again piggyback on the procedures of the telco industries. When they started with the card, and anywhere you are, as long as you had access to a PIN, you could credit your phone. But more importantly, the card gives a lot of political relevance to government sectors, because when we come in, it has to carry the picture of the sponsoring partner. It's very simple. It's a 3-step instruction at the back. Scratch the panel. It gives you a 10-digit PIN, and it tells you to enter the PIN into the phone. And when you do that, it automatically opens an electronic case note for you, such that whenever you're making that same call from that same phone, you don't have to re-enter your PIN. It's already locked you in.
Today, what we have come to launch is what I call a dream come true. In 2015, we understood the assets we had in the health sector and also the challenges in the health sector. This government inherited 292 primary health care centers, and our strategy at that time was to develop the secondary health care centers so that they can serve as referral points to supervise a cluster of primary health care centers in proximity to the secondary health care center in question. When I met Dr. Ahukannah after their conference, and he mooted to me that it was possible for us to develop an ICT backbone that can drive the deepening of healthcare service in Abia State, such that we can link up all the 292 primary healthcare centers to a call center manned by medical doctors, so that people can have access to medical doctors at the dial of a button. I quickly saw that that was the future of healthcare delivery in Nigeria and indeed in Africa.
We are trying novel ways to widen access to proper Medicare, and that is what the Abia Tele-Health is all about.
We were actually launched January 2017 here in Abia too, by the Honorable Minister for Health.
Minister came here, it was now flagged off. From that moment, I started using it.
So it's a laudable project that Abia State's government, led by our able governor, Dr. Okezie Ikpeazu, has keyed into. So Abians are very happy that this kind of project is in the States.
This is a very nice initiative that helps me and the patients.
With this Telehealth Support Center, also known as the Dial a Doc Initiative, I'm told that citizens can now, through a dedicated telephone line and affordable prepaid cards, access medical care and support from a statewide network of doctors who will be able to communicate even in local languages. We have listened to Dr. Omas, who has spoken to us extensively about the uses of this, and we have seen it actually being demonstrated. We have seen a person who actually called the telehealth center and was attended to by a doctor. This is a very commendable initiative indeed.
You can be any place when you are ill, dial a doctor, and automatically you don't need to have a physical interaction with the doctor or your healthcare provider, and you can get a quality assurance from your doctor. A drugs is being prescribed after the diagnosis, and you can get it any place closer to you without problem. So it's more affordable, accessible, and better sustainable.
Well, before now, everybody has come up with a complaint that our primary healthcare systems, which is the basic rock of healthcare in Nigeria and the developing world generally, everybody's talked about them not working because you go there, you do not see doctors, you do not have equipment, you don't have proper staffing. And so most doctors tend to congregate in the cities, the big cities, like in Abia State, Aba, Umuahia. A bigger chunk of the population who need proper doctor access do not get to have such, And so we looked at a way of bridging that gap here. It's quite new. Clearly, we know that everything is now being anchored on technology. And what we're trying to do here in Abia State is trying to latch onto technology to be able to solve the problem of access to quality Medicare.
Before now, underserved communities are now, being reached out to, and they are getting adequate care as well. Right now, from doctors.
It's really helping us because you see, most at times, in the primary healthcare system, we don't have medical doctors there. It's with the nurses that are operating there. But you see, at times, there are cases that need medical attention. So, since the existence of this Telehealth Initiative, you see now we have been able to track much clients because when they come to the clinic, they will say, we need a doctor, we need to see the doctor. There and then you will dial the doctor. They will speak with the doctor directly.
I use the dial-a-doc whenever I get a case that I cannot attend to one. Then another time is that the patients, they used to call me through dial-a-doc to ask me about vaccines or other services.
Like some of those highly placed people, they come there. At times they will use the phone to call the doctor. I allow them to speak with the doctor, and they discuss their health issues with the doctor, and you see that they are happy. They'll get fulfilled, and instead of going about patronizing quacks, so it has helped them, and they are happy about it. There was a time we had clients that had incomplete abortion. Actually, even though I've had a training on that, but I couldn't practice it until telehealth came. I had to call the doctor. In fact, we did a video call on that using the MVA apparatus. So it enhanced my capacity, my skill, and also knowledge.
The evidences are glaring. Like I said today during my presentation, something as simple as immunization, we have found out from our study that a child is 25% more likely to be immunized when the mother is sure of the availability of vaccine in the health center, and she does this over an average of a 40-second call. But that same child is 33% likely to be a missed opportunity. If the mother presents in the call center and she's told there's no vaccine, come tomorrow.
People calling to ask about our days of immunization and all that. Ordinarily, maybe they wouldn't have their children immunized, but because of this, we distributed they have our phone numbers, and so they call in to find out the days of immunization, and you see them bringing their children.
And this is what the government have been preaching, the universal coverage, where you can be any place and take quality healthcare delivery service. As we said, health is wealth. So this has ameliorated some problems being embedded in the health sector.
So whether you are in some primary health care center in faraway Chukwu in the north, or you are in some faraway medical center, primary health care center in Owaza in Abia South, you can just by simply using this card, either from a primary health care center or from the comfort of your home, you're able to be put on straight to a doctor, and then have quality consultation, and then of course quality outcomes.
I would like to thank Dr. Omas, our Executive Governor, Governor Okezie Ikpeazu, for this initiative. I would like to appreciate them because in fact it has helped me as a person. And just like we said, initially when we were having we were thinking that it will affect our client flow, but it did not. Rather, it enhanced our client flow. And we equally told them that if other PHCs, they could reach out to them so that all of us will enjoy this.
Even if you don't have money, it's affordable. With 500 and 1,000 naira, you can get a quality healthcare service through this Telehealth Initiative. Unlike when you go and spend thousands of naira queuing in a hospital just to see a doctor. And you see this, most people who have some illness that cannot be able to talk to people one-on-one. This can reduce to, you can see the doctor, discuss with him on phone, and if there's a need for you to see him, you can now make a referral for that. So this fortunately has made things easy for us.
What we're trying to do is, despite the Doc Direct is supposed to help reduce all the medical tourism and all the works, retain healthcare in Nigeria, we're also looking at cases where you could be holidaying abroad and, maybe even have something like an allergy, a food allergy. You should be able to, your health provider should be able to access your case notes and see what other associated conditions you could be suffering from, drugs you are on. So all you would need to do at that point is to give your PIN or your access number to your healthcare provider, and then they can see that from wherever you are. So it's just electronically being like a pre-first responder to people requiring clinical care or basic clinical information.
That's simply what this is all about. Widening access using the increasing teledensity in Nigeria, because literally everybody now has a telephone. And like telephones are now being used to do literally everything. You no longer have to go to the bank and then sleep on the queue. You can sit in the comfort of your home and then make transfers. Is that not true? So we are also trying to use it to widen access to healthcare.
With this initiative, I am confident that we are going to do something about life expectancy in Abia State in a positive way, because it is my desire by 2019 to push life expectancy in Abia State above the national average.
If a person knows better, he will ultimately do better. And I think the only thing more scandalous than a person dying from a curable disease is to die from one that is preventable.